Hello, I'm Danny. I survived bladder cancer, spent some time with this thing strapped to my leg, started writing, became a dedicated cancer advocate. I used to look like this fella. I didn't have an off switch. Real diamond in the rough. So I motivated myself. Due to, let's be real, my intense fear of death. Here's one of those self-realization moments. I became serious about my health. Finally started that six-pack I always wanted. I began to live my best life. This is my cancer story. Today we are going to look at alternative bladder cancer therapies, one of which is brought to us by Johnson & Johnson. It's called TAR 200. It's going to be coming out on the scene this year, and it is a gemcitabine delivery system. We're going to compare it to the current gold standard in bladder cancer therapy is BCG immunotherapy. I'm currently under that for non-muscle invasive bladder cancer. And then we're going to look a little bit closer at the TAR 200 medicine delivery system itself. I'm going to try to show everyone how I do my layman research on cancer and how I get to the factual logical information that I take to my doctor so I can be informed and ready to go when it comes to my survival. So without further ado, I guess we'll just start at the beginning.
August 2nd, 1975. Legend was born at Community Hospital in Springfield, Ohio.
Wait a minute. Not that far back. When I am heading out to research my particular issue, which issues come up all the time when it comes to cancer, and you're in active treatment for cancer, you have any type of cancer, you're going to be going through procedures, you're going to be getting new information all the time that you have no idea about. Some of it's not very much common sense. So go to Google. When we go to Google, a great amount of information on Google, because you got to remember, we're not looking for a scientific journal necessarily, but if we can read them, that's good to have. But we're going to see what kind of information that we can drum up on our particular subject. This is going to make us more effective in our cancer treatment in all ways, mentally and physically. So simply put TAR 200 into a Google search, and I refined this one to go to the latest results first. So on January 15th, we'll start right here at the beginning of it. The first one that I always check out, that this new drug application is initiated with the US FDA for TAR 200, the first and only intravesical drug releasing system for patients with BCG unresponsive, high-risk, non-muscle invasive bladder cancer. So right away, we need to hone down exactly what our issue is. So if I was going out onto Google and looking this up for a possible therapy, where do I fall with this one? Well, I have non-muscle invasive bladder cancer, for sure, NMIBC. I have intermediate risk, which could put me in the category for this, but I am BCG responsive. This particular therapy is for BCG unresponsive, so I have no other options. I am BCG responsive. I have been for about a year now, and there's no reason to think I'm not, even though the more time goes on with bladder cancer, the more your statistics do not work in your favor, and there's a lot of people out there that have return tumors. So any new therapy that is effective is going to be great for the different cross sections of people with bladder cancer. Upon approval, TAR 200 promises to be a meaningful additional treatment option for certain patients with NMIBC, non muscle invasive bladder cancer, addressing a critical need for people who have had relatively limited therapeutic alternatives. Many patients face life altering surgical options such as radical cystectomy, which is complete bladder removal. And this is what we're trying to avoid. This is a big, big part of it. If you can land early with NMIBC and retain your bladder like I have, I count myself to be very lucky. By combining our expertise in innovative medicine and medical devices, Johnson & Johnson is uniquely positioned to transform how we treat certain types of bladder cancer through the first and only intravesical drug releasing system for this disease. We look forward to working with the FDA in review of this application. TAR 200 is an investigational intravesical drug releasing system designed to provide sustained local delivery of gemcitabine into the bladder. It is placed into the bladder by a healthcare professional using a co-packaged urinary placement catheter in an outpatient setting in under 5 minutes and without the need for anesthesia. My BCG therapy goes in a very similar way. It's just the liquid or the medicine is placed into my bladder, and I got to go back a few times. Now, with this gemcitabine, we'll look into later, the device used is right there above me. It stays in there, it appears, and it releases gemcitabine into the bladder in a controlled way over time, which apparently makes all the difference in the world. Now, I won't really embellish too much on this particular article, but when it comes to my particular cancer journey, when I was looking up information on BCG immunotherapy, these high statistics are just great. There's something that we can use. You know, these scientists and people involved with this are looking into this to try to save our lives. So when TAR 200 monotherapy shows greater than 80% complete response rate in patients with high-risk non-muscle invasive bladder cancer, this is absolutely huge. The problem with high-risk patients that are non-responsive to BCG, they're getting a therapy that is responsive. Now, I had gemcitabine after my surgery when I woke up and after my stent removal when I woke up. Do not quote me, but there is a lot of information out there on gemcitabine that talks about when and where you use it, how it has a very big effect on controlling tumors. The high complete response rate and durability of these responses observed in patients treated with TAR 200 underscores the potential of this treatment approach for patients with BCG unresponsive high-risk, non-muscle invasive bladder cancer. These results address an area of high unmet need for bladder-sparing therapies in this patient population, which takes me back to BCG being the gold standard for many years. We'll go over that in a little bit too. This is an older article. I wanted to demonstrate a few things that I end up seeing statistically when I'm looking up cancer results. This shows a 77% complete response rate at an earlier date, down here October 22nd, 2023. So I can't exactly tell you how much earlier that was, but they've gone from 77 to 80, which actually proves that they've been doing ongoing research. And you can read these articles and you can get a little more in depth if you wanted to about those leaps that they've made as they go. Once again, if you look around, I was able to look up this particular therapy, which is very new, and find many, many different articles about it. You can go way back. This is not only it. This is just 3 or 4 that I've found on a relatively unknown treatment that's getting ready to come out and being reviewed by the FDA. Here are a few physician videos, someone talking about the ins and outs, someone trusted who you can hear this information from. Some people need that. You know, they might not want to research. They might just want to see somebody else who's qualified talk about it and deliver that to them. So there are a few videos available if you just do a search for TAR 200 if you happen to fall in this category. One website that I found that is just great for this is PMC PubMed Central, and if you go through a search on them, it takes you to different scientific studies. Maybe not the actual scientific study for TAR 200, but there are people, from what I can tell here, have done studies of the study, let's say. So TAR 200, the safety, tolerability, and preliminary efficacy of a gemcitabine releasing intravesical system TAR 200, an American Urological Association. So it found it in the National Library of Medicine, so we can look at it. Somebody's gone through this and they've looked at it and they've researched the research in order to bring it to us in a little bit clearer of a way, or to actually they verify a lot of information when you run into these studies. They'll look at the studies that were done and see if they were done effectively or not. When I was diagnosed with bladder cancer in September of 2023, I was extremely confused. I knew nothing about cancer. I just didn't know what to do. So I started my research then, and I feel very lucky that we live in an age where you can look this information up and feel better about your situation, maybe find some optimism. But in my research, I found on National Library of Medicine the actual studies for BCG immunotherapy. And I'll let you go to this. I do have another video out that explains this. If you want to take a look at it, I go through the BCG immunotherapy study if you are lucky enough to be able to have this therapy and are responsive to it. Because like I said before, TAR 200 is actually alternative therapy for people that are unresponsive to BCG. But you're going to find statistics in here and diagrams in here, and the last study I believe was 2015 and 2015, no, actually 2021, and they got the tumor recurrence rate down to 8%. So definitely check the National Library of Medicine site out. Do a search for whatever you have a problem. I promise you, it's not too much for you to handle. You just got to take it slow. You just got to read it. And if not, you can always come to me and I will try my best to explain it to you in understandable terms. Lastly, we are going to look at the medicine delivery system for TAR 200. Here's a nice graphic of it here. TAR 200 is an investigational drug delivery system that uses osmotic mini tablets to release gemcitabine into the bladder. TAR 200 contains gemcitabine and urea mini tablets within a dual lumen silicone tube for gradual release of gemcitabine by an osmotic delivery mechanism throughout the prescribed indwelling period. It's inserted intravesically via urinary placement catheter, after which it self-coils into a bio-oval shape. So that makes a little bit of sense. Here it is right here. Obviously it's straight when they put it inside of the bladder, and it coils in on itself. Now, when it comes to something like osmosis, what I remember from science class was it is a process which molecules of a solvent tend to pass through a semi-permeable membrane from a less concentrated solution to a more concentrated one. So that's just very basic, but that's how this thing is going to work. It's going to have medicine, it's going to have a semi-permeable membrane, it's going to be released over time. Very simple. You can deep dive it if you want, but right here is the placement and the device itself and the size of the device. You first look at that though and you go, man, that's a quarter, but yeah, they uncoil it and it's a lot more easy to slip in there. So that is it for this episode of our research on TAR 200. I'm going to drum up some more information and I'll bring one or two more videos to you on it, but until then, thank you Johnson & Johnson for making this product available. And if you have any questions at all about bladder cancer, cancer in general, mental, physical health in the cancer community, please let me know. Check me out on my social media. I am an active advocate, and let's get this done together.